What's your name and what do you do?
My name is Patience Nantume, and I'm a qualitative research officer for the Dolphin 3 study at IBI, Molago.
Okay, can you tell us a little bit more about what that involves?
It involves quite a lot, from drafting manuscripts to data collection, then to analysis, not forgetting everything that comes with data collection, like QA and QC, making appointments, identifying the participants, and then thereafter analysis, and then report writing, and of course publication. So it all is embedded in that.
I see. And for the audience, what's QA and QC?
Quality control and quality check and quality control. What we do in qualitative, after data collection, after we've collected the data, remember our data in qualitative is too much narratives. So we take the data for transcription from audio to paper to words. So we give a task to someone to do transcription. But after transcription, I have to go ahead and then listen to the audio at the same time as I'm reading the transcript to make sure that the transcript is exactly out of the audio. So that is QA/QC of the data in qualitative.
Could you describe what a typical workday is like for you?
Oh, that's interesting, but it also depends on the day. Like, should I say, probably maybe if it's an activity day. Of course, prior to the activity, we do a lot of arrangements of documents that we're going to use. For example, if I have to collect data at a certain probably point, maybe if I'm going to a facility to collect data, qualitative data, prior I have to arrange documents. All study documents. I'll have to make sure that I have the tools with me, I have the informed consents, I have the reimbursement logs, I have enrollment and screening logs. There are so many logs in qualitative. I have to make sure that I have all those documents, and also not to forget the black pens, because in research we use black. That's quite important. So I have to make sure that I have all the materials that I'll use, file them, and also I'll have two files. That is the file for empty documents, and then the file where I'll put the filled documents, because research is quite sensitive, that we have to take great care of the consents. So we file them quite different and then protect that file. So I head off and go to the field. By then, my participants would have been mobilized prior the coming. So when I reach, I find my participants. Of course, I create rapport. In qualitative, rapport is quite important. Then after that, we dig into the business. So we go through the consenting, and then we fill all the necessary documents. After consenting, we dig into the interviews. And after the interviews, of course, we file everything, we put things together. And then back to office. That is if the day is for data collection.
I see. So it's quite a varied, your days are quite different day on day.
Yeah, they are very different. There are days where you have a lot of office work. For example, when you maybe even during analysis, you find that you're confined in one place. You don't move out of office. During preparations, so really days are so different.
They keep it exciting.
Yeah, they're so different. Like, you might find a day you have so many emails to track. You have to run after probably making appointments. You have to make requisitions for the things that you're going to use during your study or even in the field. So you might find that day you're just on the laptop doing a lot of that work, responding to this and that. There is also that day. Then there are days when you have to run out to the sites to make appointments. You might find, like the D3 study, we're going to work in KCCA sites. There are 7 facilities. So you find that you have to make appointments, or even you have to book your participants. So you have to go to the sites. You start with one site, go to the in charge, introduce yourself, probably even with the introduction later. Then they attach you to probably the person in the kind of setting. For example, now that we're working with breastfeeding mothers, you get in touch with the EID personnel. Then you make arrangements, then you schedule your participants, when should they come in, where would they sit, and all that. Then after arranging for that site, you run to another site until you have all the sites arranged. And also, of course, booking the days. So on this day, I'll have to do this site. Yeah.
And what's a KCCA site?
Kampala City Council Authority Health Facilities. They're usually maybe Health Center 3s, Health Center 4s, but they are managed by Kampala City Council Authority. So they are KCCA sites.
When does the world need qualitative research?
Actually, the trend has moved. We now like qualitative research. Yeah, initially it wasn't a thing. It was actually very rare to have studies which are qualitative. But now, qualitative is very important, especially if you want to inform another study. It is quite important that you first go and hear people's experiences and perspectives and even their knowledge before you can design a study. Okay? Like the moment you go and listen to what the people know or what perspective they have or the experiences they are going through, it gives a better insight in the probably even clinical trials.
What do you wish the public knew about qualitative research?
They should know how important they are and how their views are important to research. So when we go to the public for their information, they should be as open as possible because this is the beginning of any kind of research. So the public is very important to us.
What qualifications would you say have been useful or would you recommend to students wanting to follow the career path that you've taken?
First of all, it depends on which area. Now, for my sake, I have a background in psychology and also in public health. Yeah, so social sciences is a very good aspect if you want to do qualitative research because it's the backbone of qualitative research. And these elements are very good because remember we are talking to people. You have to know how to manage people. You have to know how to approach society. So it is very good to have those qualities from social sciences and psychology. You realize that most people from the medical side, they don't have time. They don't want to do with anything to do with words. All they want is numbers. You know, what is the percentage of this and that? But in qualitative, you have to be very patient and ready to listen. You have to have that listening ear, you know, because people are going to talk and talk and talk. But most scientists, they don't want those words. They don't. Maybe be fast, you know. But in qualitative, you have to have that social scientist bit or element in you so that you can execute because you have to do a lot of listening without judging. Yeah.
And how did you get to work in qualitative research?
Yes, initially, actually maybe I didn't have a direction initially. I don't know, but with my background in psychology and then public health, with the health setting where I'm working, I'm a very important aspect when it comes to research and qualitative in particular. Yeah, but it's basically the bridging of psychology and public health and then health setting as an organization where I am. Yeah, they gave me the platform to be in qualitative research.
So it kind of combines the two interests that you had.
Yes, to end up in research because I had interest in research, by the way. I had a lot of interest in research, but I didn't know that I would end up into the qualitative. But when I started working, then there was this gap of qualitative, and I did fit perfectly well there because of the knowledge I had and also the experience and the exposure. Then I ended up in qualitative. Yeah.
What would be your one piece of advice for someone who wants to pursue a career in qualitative research?
You have to love narratives because these people, they are going to talk and talk and talk. You have to be willing to read, you know, and also you have to be willing to learn without judging, you know, because the experiences that you're going to get from the field, they are very much learning points because these experiences sometimes are broad. You know, when you're doing qualitative, of course you have to first do literature review. You know what you anticipate to find in the field, but sometimes it's so interesting when you reach there, things are totally different.
Yeah.
Very different, and you might find they're more interesting. And if you don't have a broader mind or a mind that is willing to learn, you might miss out on important points. Some people have failed in qualitative because they are rigid. this is what I want to find out, this is what I want to find out. But if you go with an open mind, you'll come up with a lot of information and knowledge, because the community, in their perspective, they have information.
So I guess it's keeping an open mind going into many interviews and things.
Exactly. You don't have to direct them on what you want to hear, but you let them flow naturally. You'll get a lot of information.
So one of the things that we are focusing on is kind of making sure that people have good, reliable sources of information and tackling misinformation, particularly on public health and general health topics. So we'd like to ask you, where do you get your health information from?
From articles, peer-reviewed articles. Yeah, I read articles more. Yeah.
And given all of your experience, what would you say is the most rewarding part of your job and the work that you do?
I think learning from the people, learning from the communities, it is very satisfying. And also, actually listening to them. One thing I've realized is when you're doing qualitative, people will pour out their hearts. People have different issues they're undergoing. But remember, in qualitative, you don't judge them. There is no right or wrong answer, or wrong response, or right response. All responses, they are taken with great care and they are appreciated. So every time you sit and listen to a participant without telling them, oh, stop there, you're going astray, something like that. After the interview, they feel like they've been listened to by a person who is not judging them. And they'll feel grateful and happy. Every time after the interview, oh, at least I've got someone to talk to. Thank you very much for listening to me, So it is rewarding that, well, I've been listening, I've been getting my own information, but even the other person has appreciated the fact that I've listened to them.
So there's like a benefit, I guess, for both of them to have that conversation.
Exactly. So for me, I always feel happy after talking to them, and they're happy also having talked to us, So it is very rewarding. And also the batch of knowledge that I come out with is very rewarding.
What's been one memorable moment from your career so far?
I think when we went to the field and we were talking to a very rare group of people. These are traditional birth attendants. And the kind of information they gave us was a bit surprising, but interesting at the same time. Okay, we're carrying out a study, and we wanted to know the contribution of the TBAs to the mothers, the pregnant mothers. And we went and visited one of the TBA. We had an interview with her, and we were talking to her. She was very confident, and apparently she was supporting a number of mothers. And then as we were talking, she was giving us information, saying, you people, you don't know how much work we do for these hospitals. It's like, okay, how? Like, how much do you give back to the hospital? She told us that, do you know that some health facilities, they send mothers here for us to support them to give birth? I said, what? Health facilities? They send mothers to you? And yes, some mothers, they go to the health facility, they fail to deliver, like they be there day one, day two, day three, nothing is happening, but they're in labor pains. They send them to us, and then we give them, they have a concoction, they give and all that. Then it's upon the mother to make a decision, either to go back to the health facility and have the baby there, or even to have the baby there at the TBAs, So I was like, health facility failing, and then they send to you, and you make your conclusion, and then actually up to now, I don't know how it happens, but I was so surprised. I'll never forget that interview. Though, of course, you're not supposed to judge them, neither are you supposed to probably follow up on them, but it is a mystery that is still ringing in me. And I don't know how it happens, The health facility failing, then they send to the TBA. TBA gives whatever she has to give, and then the mother goes back to the health facility and gives birth. Okay,
it's incredible.
Interesting. Up now, I don't know how it happens, but it is something. So I think the community has a lot. There is a lot going on. But with the numbers, the quantitative, we might not know what is happening in the community. Because with quantitative, we go there like to take the preset questions. But with qualitative, we go with an open mind to let them speak wherever they. So a lot of information comes out, a lot of information which even you don't expect. So with the less qualitative, we're missing out a lot. Yeah.
And how do you see qualitative research evolving in the next 5 to 10 years?
It is going to be a great thing. It is going to be really great. One thing I'm sure of, with the development of AI, it might support in other areas, but it might not support in qualitative. Like with the fact that we have to go down to the communities, down to the people, for their lived experiences, AI cannot give us that. So I see qualitative as something that is going to be really huge and very dependent on many other studies. Many studies will be depending on qualitative, clinical trials, surveys, they'll be dependent. So I'm seeing qualitative becoming really big and broad.
So it will just keep expanding.
It is going to, definitely, because the time I started here at IDI, there was only one qualitative personnel, one person who was running through all the different researches, projects, doing qualitative. But now almost every project that comes up, it has a qualitative hand, So now we are many qualitative people, So you see how it is evolving and moving, So I think it's going to be a very big thing.
Well, thank you so much for your time today, Patience. It's been really interesting to speak to you and hear more about qualitative research and all that it involves. Any final words?
You should go for it. You should go for qualitative. It's really interesting. Actually, it gives me a smile that this is what I'm doing and I enjoy it, and I love it. I don't think I know it all, but I learn every day. And I'm pushing to see that I'm somewhere. I don't know where, but somewhere beyond where I am today.
Thank you so much.
Welcome.